Singapore wakes up. Wake up, Glenn, Angel, and the Flying Dutchman. Wake up in the morning feeling like Kiss 92's Big Show.
It is Angel and the Flying Dutchman, as well as Dr Lim Choon Pin, Cardiologist, Mount Elizabeth Novena Hospital, because it is Good Morning Hospital. I was going to say Good Morning Hospital Day. Good Morning Doctor Day. Good morning, Dr Lim.
Good morning. Good morning.
Good morning. Thank you so much for joining us this morning. Today we're talking about the link between heart failure and cancer. And I think not a lot of people know or even consider there to be a link. Yeah. But why don't we go back to the basics and find out what exactly heart failure is?
Mm-hmm. Yep, sure. So heart failure is actually a syndrome, and a syndrome is actually is a big word for a combination of symptoms. That's a result of the heart not being able to pump blood efficiently around the body. And so patients tend to manifest symptoms of fluid overload, congestion. So they get symptoms like breathlessness because they've got water in the lungs. They get leg swelling because they get water congestion in the legs. And then some of them get bloatedness, abdominal swelling because there is water accumulation in the abdomen. And overall, they tend to feel very tired, lack of energy to perform the typical tasks that we are used to doing, like even bathing, walking, and very simple daily activities.
So are you saying that if anybody feels those symptoms that you just mentioned, they could be experiencing heart failure?
Yes, exactly. These are the typical symptoms of heart failure, and they should get themselves checked up for heart failure if that.
Wow,
if they feel
okay.
That. Yep.
So with heart failure like that, how is that connected to, say, a heart attack?
Yep. So heart attacks and heart failure are slightly different. So heart failure can be a result of heart attack, and heart attack is the most common cause of heart failure. A heart attack is a condition where there is a sudden acute stoppage or like a blockage in one of the heart arteries, leading to death or damage to part of the heart muscle. This can lead to a weakened heart, and if not treated in time, that can cause a permanent damage, and the heart becomes weak, and patients manifest heart failure. So heart failure is a consequence of heart attack.
Heart attack.
Right, okay. I see. Okay.
Yeah, I'm envisioning like pumping a balloon, almost getting oxygen, getting air into the balloon, and that's your heart. If it doesn't pump properly, then you get heart failure. But if you get a blockage in that pump, then it's a heart attack.
Exactly.
Yes. Okay, I've got that down pat.
Okay.
Now. All right.
So we understand heart failure. The reason why I wanted to ask that question, and why we asked that question, is I have friends who have had a stent put in, and they go, "Oh, I had a stent put in because I had heart failure." That's not what it is.
No, they are slightly different. It's heart failure is often confused between heart failure, heart attack, and even cardiac arrest.
Right.
So heart failure is a very chronic kind of a condition.
Okay.
Heart attack is quite sudden blockage, severe chest pain, rush you to the hospital, let's unblock the heart artery.
Yeah.
And cardiac arrest, on the other hand, is where there is a sudden fatal or lethal heart rhythm problem, arrhythmia, and the heart suddenly stops beating. And that alone, that as well has got many different causes. So these three terminologies tend to get a bit confused amongst the public.
Well, I always thought cardiac arrest and heart attack was the same thing. It's not.
Slightly different.
Slightly different, right? Okay. One is a blockage, and one you said is like a rhythm problem.
Yes, exactly.
Right,
so a heart attack can result in a cardiac arrest, but there are many other causes of a cardiac arrest as well.
Got it. Okay.
Right.
The medical terms are very complicated. But okay, so here today we're talking about the link between heart failure and cancer. So since we started off on heart failure, let me ask you this first question. Are patients who experience heart failure more prone to developing cancer?
Yes. Actually, that's the reason for today's talk, because often we think of these two conditions as very separate entities, but there is emerging data to show us that actually patients with heart failure have a higher risk of developing cancers, and patients with cancers have a higher risk of developing heart failure, and that is pretty well known.
Okay, let's talk a little bit more about that on the Big Show TV. If you want to join us on Facebook and YouTube at Kiss 92 FM. Right now, here's Marshmallow featuring Dove Cameron with Other Boys on Kiss 92. Okay. Yeah.
So as we're talking about this, if you guys have questions, you can place your questions on YouTube or on Facebook, and we'll try and answer Dr. Lim as many as we possibly can. So heart failure and cancer and heart failure. Why?
So there are many different postulated mechanisms. Maybe the direct cause is not known, but we do know that patients with heart failure, they as well as cancers, there are many common risk factors. So we think that maybe all these risk factors are resulting in either or both of these occurring. So these risk factors include common ones like diabetes, hypertension, hyperlipidemia, high cholesterol. So these tend to result in heart conditions, heart failure, and they can also increase the risk of cancers. Other conditions, other risk factors such as lifestyle factors like smoking. Smoking is well known to cause both heart failure as well as cancers. Yeah. And then the sedentary lifestyle, we tend to think that being sedentary doesn't really cause much problems, but really that is also, they also contribute to heart failure as well as cancer occurrences.
Because you're basically not exercising your heart.
And
Exactly.
you need to pump it, right?
Yeah, you need to pump it.
Heart failure sounds more of a lifestyle condition than a hereditary one, right? Am I right to say that?
Not all the time, again.
Okay.
There are many lifestyle causes like, as mentioned, hypertension, smoking and all this, leading to heart failure. But there are also many non-modifiable causes like family history. Some patients have got the genetics that increases the risk of them developing heart failure. We call them familial cardiomyopathies. So they can have genetic conditions. So if one person in the family has got heart failure, not as a result of blocked arteries, but like unknown causes, there is a higher risk that another family member can develop heart failure. So there are other medical conditions as well that may not be controllable by the patients and can lead to heart failure.
If I come from a family that has a high history of heart failure, other than exercise and eating right and not smoking and are there medications I can take to lessen my chances of getting this?
No, this is an area of a lot of research, but right now, unfortunately, there's no medications to preempt or to prevent the development of heart failure, and therefore we recommend all these lifestyle controls. So if you have a family history, it's not the end of the world. It's not that you can't do anything, but the more you should live a healthier lifestyle, and the more you should get all these cardiovascular risk factors.
Are there tests I can take?
Well, if there is a strong family history of heart failure, there are genetic tests that we can do to see whether you are more prone to developing heart failure. But even if one had the gene, it doesn't always manifest and doesn't always result in disease.
So it's not like, because when you say the heart doesn't quite pump enough oxygen to the rest of the body, I feel like it's hard to breathe. Do you know what I mean? I get that feeling of having breathlessness, right? Can you fix that breathlessness? You know, I mean, to increase that on its own, besides exercise and stuff like that.
Yeah, definitely. So if it truly is a case of heart failure, we've got plenty of medications that can help to make the patient feel better. So we've got medications to clear the excess fluid from the body.
Okay.
So the
bloating.
Water, the bloating, the leg swelling, the water in the lungs, these can be cleared through the kidneys and through urine.
Right, okay, flushing the system out almost.
Flushing the fluids out, literally. But we also have got medications that can prolong people's lives. These are, we call them the ACE inhibitors, the ARNIs. There are plenty of medications around that have been proven to reduce mortality as well as improve the quality of lives of patients. So we've got many different drugs available these days, actually.
Can anyone take those drugs?
Not preemptively.
No, because you say this is to lengthen your life, you know what I mean, and slow down your mortality and all that. It sounds like almost like magic where you can just prolong anybody's life.
So these drugs have been proven to treat conditions, but with regards to preventive measures, we don't have that data because the studies are still a bit conflicting.
Not just yet, right?
Yeah, for prevention.
Okay. One question before we go back on air. What can patients with existing conditions do to prevent it? So basically heart failure.
Yeah. So patients with hypertension,
Yeah.
diabetes, high cholesterol, or they are obese, overweight, they can try to control these conditions well to prevent the development of heart failure. So this is, we call these conditions stage A heart failure, where they have risk factors. They
Okay.
haven't developed heart failure yet.
Okay,
Yeah.
okay.
So patients who have got heart conditions, there are medications that we can then start treatment to prevent the development of heart failure. Those patients with post-heart attacks,
Okay.
we've got medications to prevent them from heart attack progressing to heart failure. And then those who have got heart failure, we've got established guideline recommended treatment already.
How many stages are there?
Oh, we have got 4 stages, like cancers.
A, B, C, D.
Like cancers, yeah.
Okay,
So
okay.
A, B, C, D.
And that's why you don't say stage 1, stage 2. You don't want to confuse it. Is that what it is?
Yeah,
Because
so we've
cancer is already
Yeah, so
in numbers,
that's
right?
That's right. Stage 1 to 4 is very well known for cancers, but not so much for heart failure.
For heart
Okay,
failure.
got it. Okay, let's go to traffic and then go back on air.
Like a skyscraper. Kiss 92 traffic.
A number of situations if you're out there on the road, on the PIE towards Tuas, an accident after Paya Lebar Road with congestion till Bedok North Road, avoid lane 1. Also on the BKE towards the PIE, a vehicle's broken down after the Dairy Farm Road entrance. And finally on the BKE towards the PIE, another accident spotted before the Bukit Panjang Road exit. If you see anything at all, update us, 88550920. We are with Dr. Lim of Mount Elizabeth Novena Hospital. He is a cardiologist and he's here this morning to speak about the link between heart failure and cancer. Good morning once again, Doctor.
Good morning, everybody.
Interesting questions are coming through on our Facebook. For example, David Boo is asking, what about someone who has an irregular heartbeat and has been having a slow heart rate, but they're not sportsmen? You know, sportsmen, when they rest, their heart rates are usually very low. What's the likely cause of something like that?
Okay, so this will be different from heart failure. So there are many different components of our heart. We've got the coronary arteries, the blood vessels that supply the heart. So that can get blocked. The heart muscles can get weak or get stiff. That causes heart failure. And then we actually have this, I tell my patients, an electrical conduction system in the heart. It works like the electrical circuits we have in our false ceilings. You can't see them, but they are there. They actually coordinate the function or they coordinate the pumping of the heart. So if this goes wrong, something goes wrong with the electrical system, the conduction system of the heart, that's where we get irregular heartbeats, extra heartbeats, slow heartbeats, fast heartbeats, and that's the rhythm problem, and we call this the arrhythmia.
Arrhythmia.
Yes, so that's the heart rhythm problem, and that's exactly what this audience is mentioned.
Is talking about.
Okay,
Yes.
okay. So what it sounds like, and although I know every organ in the body and every part of the body has a part to play, but the heart sounds like the main engine of the body.
Yeah, you're right.
How do we keep it well oiled? You know what I mean? Because that's really what we want, right?
Yes, you're right. The heart is central. Every organ depends on the heart. And therefore, in order for the heart to supply enough blood to the rest of the body, there are many ways we can take, other than taking medications to prevent the heart from weakening. So there are, we call these the modifiable as well as the non-modifiable risk factors, things we can do something about. Modifiable risk factors include very commonly diabetes, high blood pressure, high cholesterol. You see me repeating this.
Modifiable, yeah?
Yes, modifiable. So if you have any of these conditions, get them treated well by your GP, by the doctors who's taking care of you, because these are very, very important to take care of. And then we've got, if you don't have them, go for regular screenings. So in case you have them, get them treated. We've got smoking. Smoking is a very bad condition, high risk of developing cancers, heart failure, blockages. So these should stop, right?
Yeah.
We don't even say cut down. I mean, we can cut down slowly, but we should stop ultimately. Sedentary lifestyle, we recommend exercises, and exercises we're talking about moderate intensity exercises, well, the types where slow jogs or brisk walks.
Some movement.
Yeah. 150 minutes per week.
There's like 30 minutes a day, right?
30 minutes a day, 5 times a week. They prevent both heart diseases and cancers. So you see oncologists also recommending this kind of regime for the prevention of cancers. And of course, a healthy lifestyle, right? A healthy diet, right? We don't want to eat too much sugars, high salt diet, high fat diet. These are bad vegetables, fruits, high antioxidant fruits and all that. These are good for prevention of heart diseases as well as cancers, right?
Yeah, I feel like the medical industry has been just saying this on repeat for
It's been years.
centuries. You know what I mean?
Yes.
Get good diet, exercise, live well, stop smoking, don't drink so much. You know what I mean? And still people don't learn.
It's humanity's favorite cop-out line. It'll never happen to me.
Yeah.
It
I
won't
only
happen.
live once.
Yeah, it won't happen to you until it happens to you.
Until it happens to you, yes. Let's talk more about it not happening to you. That's the main
Yeah.
thing. On the Big Show TV, the time right now is 8:17.
Kiss 92 Time Check brought to you by Putian.
Yeah, because I guess it's like you guys are regurgitating this, and it's common sense, and it's everybody knows this, but nobody is doing it.
Exactly. I feel like a tape recorder every time I see a patient coming in.
And it must be frustrating for you guys as well. I mean, the doctors, you're trying, they're giving the best advice. We're telling you not to be on medication, even though everyone thinks doctors are trying to prescribe medication, for all that monetary, but you're not. I mean,
No.
you're constantly telling people to live well.
Yeah, exactly. So we recommend these lifestyle changes, but unfortunately, it's harder to do them than to pop that pill. So most patients are more receptive to taking that pill than
to changing their lifestyle.
Than to changing their lifestyles, right? So
Wow,
it's really,
even when they're diagnosed.
no, I think in Singapore
see.
it's tough. There are so many things. So you
food.
turn to one side and you see a buffet. The
Yeah,
other side you get
yeah.
an offer to.
But that's just one thing. That's just food.
Oh yeah.
You know
that's
what I
right.
mean? Like I think in terms of the smoking, the government has done a lot to cut it down.
A lot.
Like only these smoking pockets and
Yeah.
the whole of Orchard Road is smoke free. So that's great.
We're heading in the right direction.
We are.
It still takes a lot more work. But I want to go back to popping that pill and not doing what you should be doing. So I had a blocked artery 14 years ago. So I'm on pills. I'm on cholesterol pills and I'm on the list. And I always worry, does medication like that, because I'm on it lifetime, right?
Yes.
So does medication like that put me at risk, at higher risk
For heart failure?
for heart
Cancer.
failure, for cancers, whatever?
So we are doctors, right? We're here to protect lives, and definitely,
Absolutely.
if it puts you at risk, we will not put you on it.
Right.
So definitely, the scientific evidence outweighs the risks
Right.
Okay.
by a big margin.
Right.
And in this case, we know that these medications that you're on, blood thinners, cholesterol medications, they help to reduce the risk of heart attacks and strokes over the long term.
Okay.
We know that every medication, unfortunately, has some risks of side effects.
Yeah.
Sometimes they affect the liver, but risks are like 1 to 2%.
Yeah.
If the problem is if you don't treat them, you have a higher risk of heart attacks and strokes.
Yeah.
So yeah.
So someone like myself who's been on this for so long, I always ask, and silly me, I've never asked my GP this. Should I go for liver checks and things like this every X number of years?
Right.
For example.
So the blood tests that you'll be doing periodically
Yeah.
with your GP, that should be sufficient
Should be
to
sufficient.
pick up any
Okay.
damage.
Okay.
But
Okay.
it's very unlikely to happen.
Okay.
I just want to ask you, because FD was talking about it being on this whole cocktail of drugs for his heart.
Yeah.
And you mentioned it should not cause any heart attacks or strokes and stuff like that. But what about heart failure and cancer, which is what we're talking about today? Is he at risk for that?
Exactly. So unfortunately, once you develop heart problems, cardiovascular disease, blocked arteries, heart failure, you are at an increased risk of developing cancers in future. So that we have got some registry data that shows that once somebody has got this disease, there is about 1.7 times the risk of
1.7,
developing
okay.
cancers compared to somebody who doesn't have a heart disease.
Right,
And therefore,
right.
there is now emerging evidence or emerging data that says that maybe we should start doing surveillance for cancers and trying to pick them up earlier in patients with heart diseases.
Right.
Okay, got it. Wow. Life is so complicated. Any other questions on our Facebook, FD?
Okay, let's see what else we have. Eddie is asking, how does one get water retention in certain parts of the body? Because it's related to heart issues. How does that happen? Why are we collecting liquid if our heart is not
So
working?
the explanation behind
Yeah.
it.
Yeah, you're right. So it can get a bit complex, but I like to think of the cardiovascular system as one of pumps and pipes. So when your pump doesn't pump the blood so well, so that means that the heart doesn't pump the blood so well, all the blood gets backlogged in your pipes.
Pressure starts to collect.
Yes, the pressure builds up in your pipes. But our pipes are not. Our pipes are semi-permeable. Our blood vessels are semi-permeable. So when there's a lot of pressure, water leaks out of our blood vessels. And then they accumulate in our abdomen.
The water is coming from the blood vessels.
So fluid. Yes. So there's high pressure in our blood vessels. So then the water will seep out. And then they seep out into your organs, into your legs, into your...
Is that in relation to how much water you drink?
Yes. So if somebody drinks a lot of water, the body absorbs lots of water in your blood vessels, and therefore it can contribute to all these fluid congestion. So if somebody has got heart failure, we tend to ask them to
not drink as much water. Right? Okay. Got it. Because I have heard that instruction being given to that they have to count like how much water they're drinking. They can't go over a certain amount and all that. But I didn't realize it was because of this.
Yeah.
Okay. Wow. Okay.
Unbelievable.
So once again, let's go through the symptoms that people can look out for if they're noticing some changes in their body that they should go get their hearts checked. What are the symptoms?
So with regards to heart failure, we're talking about symptoms such as exertional breathlessness. That means you feel breathless when you exert yourself. You typically don't feel breathless for, like say, when you walk or climb one flight of stairs. So if you do, you just got to start watching out.
But over how long a period? Because some days could be worse than others,
yeah, exactly.
Right?
So I think you can give yourself a few weeks.
Okay, a few weeks. Okay.
Yeah, I probably one or 2 days. Sometimes we may have some off days. We're tired. We catch the flu, and then we feel a bit breathless. So a few weeks. Leg swelling is a very typical symptom of heart failure. Abdominal bloatedness, nausea, vomiting. As your abdomen gets more and more distended, and you may want to get checked.
Is it hard? Or is it kind of soft?
It tends to get harder and harder actually, because there's fluid buildup, pressure buildup in the abdomen. And then of course lethargy, lack of energy to perform all these tasks, blood pressure lowering, heart rate raising.
Lowering.
Yeah.
Okay.
So when your heart fails, your blood pressure tends to drop. And so if you find your blood pressure starting to drop, heart rate racing, that's when you may want to also be...
Okay, let's go on air. We can talk about that.
Yeah.
Kiss 92 traffic.
If you're traveling down the BKE towards the PIE specifically, look out before the Bukit Panjang Road exit because an accident is taking up some space. Wherever you are this midweek, please stay safe. It's Good Morning Doctor Day with Dr. Lim Choon Pin, cardiologist at Mount Elizabeth Novena Hospital, talking about the link between heart failure and cancer.
Very interesting for those of you watching. Angel's reaction to the statement: when you have heart failure, your pressure drops.
And your heart rate raises.
A lot of people think it's the other way around.
Which is kind of a good thing in terms of smartwatches these days, because they have the HR. Do they have blood pressure monitors on the
blood pressure monitors?
On
they have
the
HRs,
watches?
yeah.
So you could somewhat. I mean, I know it's not gospel like looking at this because some of them are not quite accurate, but
it's a guideline.
It's a guideline to look if your blood pressure drops and your heart rate raises, you may be experiencing heart failure.
Yes, exactly.
Okay. What are the numbers that, like people should be looking at? Like how much below their normal numbers?
Right. I think it's important, like you mentioned, to know what your normal is, right? So some of us have got low blood pressure. Ladies tend to have lower blood pressure, like 90s, 100s, systolic. Men tend to be 110, 120 in the healthy range. And some of us may be higher. So if you find that your blood pressure is gradually getting lower and lower, and I would say maybe at least about 20 millimeters mercury below your baseline, that's something to start being concerned and to check with your doctor whether you may have heart failure. Of course, there are many other conditions like anemia, bleeding from from the rectum, and all that. All these can contribute to low blood pressure. Yeah. So when your blood pressure is low, heart failure is one of them. Seek a consult with your GP to get it assessed.
And this sounds like a more urgent thing than the breathlessness, because you said the breathlessness over a couple of weeks, see how you go. But with the blood pressure dropping like that, you should seek medical attention almost immediately?
Yes, I think so. Yeah.
Okay.
How often should we check our blood pressure? Because some people get very OCD about it. I'll check
Are you
it in the
talking
morning.
about Glenn?
I'll take it in the afternoon. I'll take it again at night. How often should we check it?
Well, I think that there's no definite intervals that you should be checking your blood pressure. But really, I think if you have a machine at home,
Yes.
Once a day should suffice. And I have got patients who do 5-6 times a day, and I really think that may be excessive. But sometimes there are patients with labile blood pressure swings, and those we may require them to check a little bit more. Those are the difficult cases to control.
Yeah.
But for most of the general population, I think once a day, and once you find that it's very stable, do it once or twice a week.
And
There
always
you
at the
go.
same time of the day,
Yes,
right? Okay, yeah. Winnie has a question that's come in over our WhatsApp. She says, what about mitral valve prolapse heart condition? And I feel like
Whoa.
you're the only person that can answer this in
yeah.
the room.
Right. So we are now talking about yet another part of the heart.
Okay.
That's called the heart valves, right? So our heart has got a pump, and I talked about electrical system, arteries. Now we've got valves.
Little doors?
As well. Little doors.
Yeah,
Yes,
okay.
we've got 4 doors in our heart
Okay.
called the valves, and basically they open and close to regulate blood flow in one direction. You see, your heart pumps, blood goes forward, but when your heart relaxes, blood should be
Coming out.
back.
Okay.
Right. So these valves are one-way valves. They close.
Got it.
And so that blood can just move forward and it doesn't reverse.
back,
right?
yeah.
So, but what mitral valve is one of the valves on the left side of the heart, and many things can happen to the valves, right? And sometimes they don't open well or they don't close well. Mitral valve prolapse tends to be one of the conditions that the valve doesn't close well.
So it opens up, it goes
So
one
it
way,
opens
but
well.
it
When
still
it
allows...
when it closes, one of the flaps actually overshoots.
So there's
And-
like a little
So it
gap.
Yes.
Okay.
Yes. It overshoots, and there's a gap between the valve now.
Got
and
it.
now blood leaks backwards.
Ooh.
And the severity of this condition depends on how much blood leaks backwards. So
Okay.
we've got mild leakage, moderate, as well as severe. And in somebody with a severe mitral valve prolapse, with a severe leak or regurgitation, they may require surgery. But if it's mild, it tends not to give us much problems.
So what happens then? I mean, it's blood going in and out.
Yeah.
I mean, what is the problem with it? I know that's a problem, but
That's right.
explain why it's so bad for the blood to leak back into
so-
the system.
So as you can see, the heart is supposed to pump blood forward to supply all your organs, right? And imagine if there was a lot of leakage backwards, 50% of my blood goes forward, 50% goes backwards. So the efficiency of the pump is actually very poor. So you don't get enough blood to your organs. And when blood leaks backwards, actually it causes congestion behind. So it may cause congestion in the lungs and people get heart failure.
Wow.
Yeah. So
Wow.
mitral valve prolapse, severe case, can cause heart failure as well.
Fascinating.
Fascinating. This is absolutely fascinating.
It is.
Aloysius has come through and says, I've got a friend who's in his late 40s. His resting heart rate is 85. Is that a sign of issues? To me, a resting heart rate of 85 seems very high.
So well, again, it varies from person to person. We generally say that between 60 to 90 is considered normal.
Oh,
Yeah, we
okay.
would consider that the normal range. But then again, it varies. So I think what's important is to know what your usual resting heart rate is, and then we work from there. If it starts to go up, then you may have some other medical conditions. To be
Okay,
considered.
I'm trying to look at my heart rate. It seems like I have none. Oh, 76.
Yeah.
Is that good?
Yeah.
Okay,
That's right in
all
the
right.
middle of 60 to 90.
Okay,
Yeah.
good.
Yeah.
Okay, final question, Doctor. What is one thing you wish for anyone listening in to take away from today's session?
Yeah. So I wished I could have spoken a little bit more about heart and
Always,
cancers,
yeah.
right? But really, these are two important conditions. We see them a lot in our hospitals, and they are. While they occur very commonly, there are many things we can do to prevent, and not to be sound like a broken record, but really lifestyle conditions. Don't think about the pill first. Think about our lifestyle first, right? Control your diabetes, high blood pressure, high cholesterol. Lead a healthy lifestyle so that I don't get to see you in my clinic, right? So healthy lifestyle, exercise regularly, eat healthily, so that we can prevent these conditions from even occurring in the first place.
Okay, fantastic. So if anyone wanted to look you up, I know you don't want to see anybody, but if anyone wanted to look you up, where can they find you?
They can find me in Mount Elizabeth Novena.
Okay, perfect. And that was Dr. Lim Choon Pin, cardiologist, once again at Mount Elizabeth Novena Hospital.
Thanks for tuning in to The Big Show's Good Morning Doctor, brought to you by Mount Elizabeth
Right.
Yeah,
Okay.
yeah.
Okay.
We need to do a photo first, though.
We're done.
Yeah, we're done. See, it was easy. Okay.
Are we going back on the radio first, or we just play the video now?
We'll play the video.
We
Okay,
should wait
cool.
for Shalini to come back at least.
I guess we should. It's
If
very,
you
it's very
didn't
interesting.
know, it is Shalini Susan's birthday.
Yes. Some of the other questions that we didn't have time to get to. Very interesting. David says, David's heart rate is 50 at resting, and it can go as low as 39.
He's a dolphin.
It's crazy.
Dolphins are
39
very
seems
low.
so low, David.
Oh, this is David Yo?
David Boo.
Oh, okay.
Very-
Should try deep sea diving.
You reckon?
No, I don't know, because there's this movie called The Big Blue about these free divers.
Right.
It's based on a true story. And they actually got their heart rate down to slower than that of a dolphin to be able to hold
To
your
hold,
breath
yeah.
to go deep, you know? So
Yeah.
it may be something.
Yeah.
We'll wait for Shalini to come back, and then will we have time? We will, right? We can make time, okay. If you want to send in your birthday wishes to Shalini, please
Yes,
send
please
them
do.
in now. We're going to show you a little video in a while about us at Estiatorio Milos yesterday, the new Greek restaurant at Marina Bay Sands. It's on the same level as the Sands Theatre,
Theatres.
just across,
Right across.
literally across, next to
Roberta Pizza.
Roberta
Roberta's
Pizza,
Pizza,
and Mott 32.
32.
Yeah, so it's on that same
Really
level.
nice. Something that I do want to bring up, though, having spoken to the doctor, and Angel brought this up as well. A lot of us wear these smartwatches. Don't take a smartwatch as gospel.
That's what I said. Yeah. It's just a guide.
That's
yeah.
a very important point that Angel brought up. It's just your guide, you know, and don't get obsessive about your
Blood pressure, no.
pressure and your heart rates. And now apparently there are watches that can check your blood glucose, and just don't get obsessive about it.
I mean, I'm not a doctor, neither am I a smartwatch maker, but I think a good sort of guide would be like if you're using the Google Fitness app to look at the whole chart as a calendar and see how it varies across like a week.
Absolutely.
You know, don't look at it one day and go, oh my gosh,
Yeah.
I'm dying. You know what I mean?
Yeah.
Because you can't do that.
Yeah,
but
because even I've done it.
just
you
look
know,
at the guide.
I can sit here during a shift and have perfectly normal blood pressure. But I can sit in a private hire car, and the way the driver is driving, my blood pressure
Goes up, yeah.
You know, there are various factors.
So just so you can look at that chart, and then that's a chart that you can show your doctor. At least you can
Yeah.
you know, because it takes down everything, even if it's just a guide.
Yeah.
Okay, where's this woman? There she is. Come on.
Woman.
Birthday girl.
Birthday
We want to show the
girl.
video from yesterday. So come
Yeah.
and sit in Dr. Lim's seat.
Yes. Bernard
And
Cheng,
then you
Adam
can-
Cole.
Everyone
Faith
saying happy
Lim,
birthday to you. Put your headphones
Christine
on. So
Tan.
that's the microphone. When this is red, please don't swear.
All wishing you happy birthday.
No, we're turning you on right now.
Okay.
Is your microphone on?
Hello.
Hello,
Yes.
Shalini Susan, everybody.
Ta-da!
Da, da, da. Happy birthday to you. Happy birthday to you. Happy birthday to Shalini. Happy birthday to you.
I don't know what to do when people sing birthday songs to you.
Yeah, neither do I. I get lost. I have
You
no
just
idea.
start dancing. Okay, we're going to show this video now once
Okay.
Cheyenne puts it up.
We are on the way to Marina Bay Sands. We're going to be having lunch at Milo's.
For lunch.
Fried cheese.
Yes, yes. Love the music.
Of course, it's Greek. Just sat down at Milo's here at Marina Bay Sands, and they've curated a really special menu for us. That was the best.
So good.
Fried cheese. So good. If you try anything, this has to be it.
I love cheese.
Amazing how they skinned that fish.
Milk-fed baby lamb chops. Give it all to FD.
Yeah, right. Right.
Birthday to you. As she puts her lipstick on. Happy birthday to Charlie. Happy birthday to you. Yay! Now you've got a real candle to blow out.
Yes.
Somewhat? No, thank you. And that's it.
Nice.
Thank you for that birthday lunch, Milos.
Very nice. Very,
For
very nice.
Shalini Susan. Okay, you may go back to work now. No, actually, you know, birthday, why don't you sit down, chill out with us, let Cheyenne do all the work.
Here's something very interesting. Eddie Lowe
Uh-huh.
is wishing you happy birthday from Melbourne.
Oh, nice.
Thank you.
All the way from Melbourne.
Very nice. So, how does it feel being 35?
What?
How does it feel turning a year older?
Well, I actually missed the 12 a.m. mark. I fell asleep at 9.
Well, you absolutely should, though. You got to wake up at 4.
I usually stay up, but I just fell asleep while watching my shows on Netflix. So I think it's a sign that I'm getting older.
Oh, sleeping at 9 o'clock. Let's see what happens tonight. If there is a biggest wish, not the wish that you made over your birthday cake, but if there's a big wish, what do you wish for and what are you grateful for?
Ooh.
Oh, no pressure.
No.
Yeah. I always wish for happiness. I mean, I've mentioned this before. Like, I've always prioritized happiness, and it's not just mine. It's always also about the people around me, because I believe that the people around me matter a lot, and if they're happy, then that energy comes to me
you.
too. Yeah. So that's always my biggest wish.
And gratitude
Just
for.
anything and everything. Yeah, just being able to do what I love every day, and yeah, having friends and family that I can really rely on. Yeah.
Nice.
And you guys.
Awesome. Yay!
To our boss, Steve, she's a keeper, man.
Yeah, yeah.
She's a keeper.
Give her a day off tomorrow.
Yeah, she's
Okay.
a
In fact, she
keeper.
should go home now. Bye. See ya. Okay.
Alrighty.
I think we can say goodbye.
Yes, we
then.
do.
See ya. No pressure for talking for the rest
Yeah.
of the hour.
Have a good
Okay,
day.
We'll see you tomorrow.
Tomorrow, Adrian Chu is up, so make sure
Yeah,
you
but don't
join
go
us.
anywhere. We're still on radio till 10.
Yeah,
so, yeah. Switch us back. Bye.
See ya.